Senator Romney.
Thank you, Mr. Chairman, and thank you to each of the panelists for the sacrifice and the effort that you've been making over these past several years, or past several months, as well as years. As you know, because we didn't know a great deal about this virus as it first sprung on the scene in America, we asked the American people to basically shut down their lives, cut back on flying, family reunions, funerals, church services, restaurants, bars, theaters, everything got shut down. Well, now it's end of June, and hopefully we've learned something about how this disease actually spreads. And the American people need to go back out. They're going to go back out, and they are going back out. We saw, for instance, at the Lake of the Ozarks, all these people, and we said, oh my goodness, this is going to be a major problem. But my impression was, because people were outside, or who knows what other reason, it wasn't a major problem. So my question is this: where is the risk greatest? How is it that it's spreading? Is it spreading indoors? Is it spreading more in restaurants and bars? Is it okay to be outdoors and perhaps not socially distanced? Are family reunions okay? Can you give us some guidance based on what hopefully we know as to where the risks are greatest? I know you keep saying social distance and mask, but people are getting in airplanes, they're going to restaurants. Where is the risk greatest, and where are we relatively safe? Can you help us through that? Family reunions. Can we get together with family reunions outdoors? Is it safer outdoors than indoors? Give us some guidance. Can you do that to Dr. Fauci and Dr. Redfield?
Thank you, Senator. I think first and foremost, the most important thing in that assessment is knowing at the granular level what the kinetics of transmission are in that community. As I mentioned, we have 130 counties right now in the United States where we consider them, quote, hotspots. We have many other areas where there's very limited transmission. So first and foremost, it's knowing if you're in that area of active transmission. And then secondly, it's knowing what you do when you're in that area of active transmission and what precautions one takes. I think
got to be brief, Doctor. I only got 5 minutes.
All right. Well, I think those are the two things. I will say that there's just more and more data showing that the use of face coverings and masks are an effective way to prevent transmission in these gatherings. And I think we're just going to come back and tell you the most important thing: if you're within a community with limited transmission and you're wearing face mask, or there's significant transmission, you're wearing face mask, and you practice those social distancing, hand washing, that's the best recommendations I can tell you.
Yeah. In addition, Senator, outdoor better than indoor, bars really not good, really not good. Congregation at a bar inside is bad news. We really got to stop that right now when you have areas that are surging like we see right now. But in answer to your question, a little bit more granular, outdoor is always better than indoor. If you're outdoor distance, as Bob said, wear a mask if you can, but you can have some social interaction. The one point I want to make very briefly is that we should not look at the public health endeavors as being an obstruction to opening up. We should look at it as a vehicle to opening up, so that you don't want to just restrict everything, because people are not going to tolerate that. So you can get outdoors, you can interact, wear a mask, try to avoid the close congregation of people, wash your hands often, but don't just make it all or none. We've got to be able to get people to get out and enjoy themselves within the safe guidelines that we have. So make public health work for you as opposed to against you.
I very much appreciate those responses. I think it'd be extraordinarily helpful for all of us as we're going about our lives if there was data that indicated where people are getting infected. Were they in a bar? Were they in a restaurant? Were they outdoors at a pool? I've heard reports that virtually nobody has been infected if they're outdoors. Is that true or not true? Given how long we've been at this, we've got to have more granular data so people know where there's greater risk. How many people, for instance, have been infected as a result of flying on airplanes? We have to know that. If we can publish that information for the American people, they will know where they can be safe and go back. Of course, continuing social distancing and wearing masks, but we need that data. Finally, I'll just ask an answer. Who was responsible for distributing the vaccine? what person or what agency determines how the vaccine, when it's available, will be distributed?
Well, thank you, Senator. This is a central function of CDC where we really help with vaccine distribution throughout the nation, childhood vaccines.
So that's the CDC. That's on your shoulders. Thank you. Mr. Chairman, back to you.
Thank you very much, Senator Romney.